So in most cases, you can't feel that your HIV medicine is working, and that's because you can't really feel when your HIV medicine isn't working. HIV is a silent disease. It infects you, it replicates in your body, and most people can't tell that they have HIV. However, there are ways that we can tell that your HIV medicine is working when you come into the clinic, and we test your blood, and we look at your CD4 levels, and we look at your viral load levels. For some patients who are not doing so well, their bodies feel different when they don't take their HIV medicines. And for some of those patients, it's because the amount of HIV viral load is so high in their body that they don't feel well. They feel tired, they feel out of it. But I don't recommend that you wait until you feel a certain kind of way to figure out if your medicines are working or not, because it just isn't reliable. The most reliable way is to come in and get that blood work. So your CD4 and your viral load are tested by your blood. So when you come in, your doctor will take a couple of vials of blood, and they do that about every 3 months. And what they're looking for there is how strong your immune system is, and that's your CD4, and how well controlled HIV is in your body, so how low the HIV count is. So if a certain medicine isn't helping a patient meet their treatment goals, there's a few steps that we have to figure out. And the first step is a simple one, which is figuring out if the patient is taking the medication and exactly how they're taking the medicine. What may be happening if you're taking the medicine infrequently or you're not taking it in the way that it's prescribed is that the medicine may not be enough in your system to actually control HIV. So once we figure that out, we can make sure that you have a way that you can remember to take it more frequently, or we can get rid of the other medicine you might have been taking with it that was interfering with how effective the medicine is. And then there are those cases where the kind of second scenario, which is that your HIV has actually become resistant to that medication. So we'll take your blood and we'll check your genotype and phenotype to tell us more about the kind of HIV you have and why the medication may not be working. It's incredibly important for patients to continue taking their HIV medicines, even if they feel like they're perfectly healthy, because again, HIV is a disease that basically likes to pretend like it's not there. The good news is, as far as you take your HIV medicines, whether you feel it or not, you're protecting yourself long-term, and your immune system will stay robust, and you can have the lifespan of someone who doesn't have HIV.